Okay. Yeah, so we're recording now. Okay, so hello everybody. Thank you ever so much for joining us today. Our patients are really grateful for you giving up your time today. I'm sure you've all got your names on and who you are. So I think the only one that hasn't got who your name is me. But I think most of the people watching this will probably know that I'm Fiona Copeland and the chair of the PCD support group for the next month. And then Lucy is joining, is going to become the chair from the end of the month in June. So what we thought we'd do is just give you a little bit of an introduction. We've already had meetings with all of these great PCD experts in the last few weeks to agree what the next steps are for lockdown. And it has been agreed that basically everyone has to stay at home until the end of June. I don't think that'll be any surprise to any of you, but we're going to answer some of your questions. We should talk about the specifics. The other thing that we've also decided that children, we think it's probably safer for children not to go back to school in the first wave. So hopefully children will be back at school in September, but who knows? And we're looking at the data all the time, or these experts looking at the data all the time. So we want to make sure that you're safe. So this is the advice. The full statement will be on our website tonight. So you will be able to see it. So we're going to start with asking some questions. Lucy and I are going to split them between us. And then I'll do a little bit of facilitation if necessary. So Lucy, start with your general COVID-19 questions.
Brilliant. So I've got a question for Woolf here. We've got a question from someone asking whether you've got any evidence of people with PCD having COVID-19, and if so, how did they do?
Okay, thanks. So just to introduce myself, I'm Woolf Walker. I'm a paediatric respiratory consultant in Southampton, and I run the management service down here. So the reality is that there isn't much evidence that patients with PCD are catching or suffering with problems from COVID. And just to talk to what data we have, so we, as you know, in the National Service, talk to our colleagues as we are doing now, and we know from the adult and children's management services that actually none of the centres have had any admissions with patients with PCD who've come into hospital with coronavirus. So in the UK, well, in England, we know that's the data across our country. And then looking more widely, we are members of a European-wide reference network for PCD. And so we have some data across other centres in Europe as well. And again, we had a telephone conference meeting a few weeks ago about that. So I guess it's a few weeks old, the data. But looking to the largest PCD centres across Europe, we found that there were very few cases reported across the whole of Europe as well. So just to talk to the couple of cases that have been reported, actually not by any centres, but they've been picked up by the German family support group on social media, and hence I guess people might know about. There was one adult in America, I understand, who had been a contact of a known patient with COVID who had subsequently then had a positive test, but had little in the way of symptoms, certainly not requiring any additional input from treatment. So no consequences of having COVID for that patient. And then there's been another case of a family whose parents had coronavirus, who had a child with PCD. And again, both parents tested positive. The child, both children had negative tests and didn't have any sequelae from it as well. Finally, there's been a case in France of a patient that Jean-Francois Papon looks after, an adult patient again. And this was a patient who had some respiratory symptoms, had a COVID positive test, had a bit of temperature, had some oral antibiotics as part of the management of that, but didn't need hospital admission or anything there. So that's to my knowledge, that's all the data we have on this across both Europe and England, specifically. So we have some cases of COVID. We haven't had any cases of patients needing admission to hospital.
Okay, and I suppose the data are very small, so it's important to remember that it doesn't mean we can disregard the shielding guidelines. I've got a second question for Daniel Peckham, if that's okay, and that's about what you think about wearing face masks.
Well, I think there's much debate about face masks. There are really two different camps. I think a face mask is very sensible in certain scenarios. I think what's really important is it's about infection control, about protecting yourself, washing your hands, because this certainly could be fecal oral route, but also it's going to be droplets. So I think, you know, if you're going to go for a run, for instance, in the middle of the country, you do not need to wear a face mask. If, however, you're going to, for instance, go on a bus trip in the future after shielding, then it would be probably very sensible. What is important, though, is if you're going to wear a face mask, you do need to actually change them. It's really important not to have a dirty face mask, because you actually might increase the risk. And the other thing about face masks, a lot of people wear face masks actually to protect others. So I think that what's important is you're trying to stop coughing over other individuals. So it actually works both ways. So my general feeling is that the face is a sensible thing in the right scenario as part of the aftermath of shielding, and as we gradually get out. And certainly in our hospital at the present moment, if we do see people, we wear face masks. And the
Brilliant, thank you. The government have said that more people can now be tested for coronavirus if they have symptoms. Do you think that at some point PCD patients will be able to get the antibody tests if they suspect that they've had it already? And can we assume that if we've had it, we should be okay to not shield anymore?
For the question.
Yeah.
As people are probably aware, there's two main groups of testing for COVID. One is the antigen test, which is effectively a molecular PCR test for either live virus or bits of the virus. And that's generally positive in respiratory secretions when people have got active symptoms. It does vary a little bit through the course of the disease. Now, it's also important to say that some people may be positive for that test when they don't have any symptoms. Now, the other main group of tests is what we call antibody tests or serology. And this is essentially testing your blood to see whether you have any antibodies against the coronavirus. And this is becomes positive in people generally either towards the end of the infection or alternatively sometime after the infection, maybe even a period of some weeks. And therefore, they're sort of testing different things. And I think the important thing to say about testing is really all part of, you want to use it to ask a certain question. So one of the main uses of the antibody test is really to see whether people have been infected in the past. And therefore, the big question people have in that situation is, does that imply a degree of immunity going forwards? And the difficulty with that question is we don't really know. Traditionally, when people have antibodies against an infected organism, that does imply that they have some sort of immunity. Now, maybe that will be partial immunity, or maybe that will be complete immunity. And that level of immunity lasts for a certain period of time. So for certain things, like a common cold virus, often that's quite transient and provides very little ongoing immunity. And for some things, for example, hepatitis B, which is another different type of virus, you get a much more long-standing, that's lasting for some years, if not decades. So I think the difficulty with the role of antibody testing in coronavirus is we don't really know what the place is. I think it's going to be useful to work out on a population basis about the number of people who've had infection or had an exposure. But I think we're some way off knowing the utility of it in testing individual patients and therefore being able to give them advice about how they should, shield, how they should live their life going forwards. I think that data will come out, but we're probably some months off that, I suspect.
That's really helpful. Thank you. I think Fiona's got some shielding questions.
No, we've got one about cystic fibrosis.
Oh, no, you don't.
First.
Sorry, this is me.
Yeah.
Be good if I could read. Right, this one for Daniel. Daniel, we've got a question here saying doctors in the cystic fibrosis world are speculating, based on very few known cases of CF COVID, that the number of infections that they get may assist in preventing the worst excesses of COVID on the immune system, as they are used to inflammation in their bodies, and their bodies therefore don't react by going overboard and causing cytokine storms. Could the same be said for PCD if this is true?
Well, I think the first thing we must say is that one of the great successes has been the early intervention of shielding. So I think what's really important is we're seeing a very small number of individuals including cystic fibrosis, so we cannot make a clear hypothesis at this present time. One thing I can say is cystic fibrosis has characteristic features, what we call autoinflammation. And this means that the cells actually themselves hyper-respond with the production of cytokines. And interesting enough, the cytokines you see is IL-1, 18, and IL-6 and IL-8. And IL-6 and IL-1 are increased in COVID. So it is extraordinary that cystic fibrosis patients do have responded in the way they have, but this could just be purely because of shielding. We're seeing a small number. In primary ciliary dyskinesia, it is totally different. The immune response is nowhere near as great as you see in cystic fibrosis. So if you look at white cells in an individual PCD, they do not have this autoinflammatory component. So I think I'd be very, very cautious at equating anything. Well, first of all, we've got to be cautious about what people say about cystic fibrosis, because it's probably shielding, but we've got to be very cautious. We cannot compare these two conditions at all.
Okay, thank you very much.
Okay, thank you. So it's my turn now to ask some questions. So Manjith, if you mind asking some questions about shielding. So we think do you think that the shielding for extremely vulnerable people will go on longer than the end of June? And do you think we're going to have to wait for vaccinations before we can go out again? And then all linked to that really is that do you think that children and students will be able to go back to uni, children back to school and students back to uni in September? Lots of questions there. And I know that you might have to hypothesize a bit. Yeah.
Again, to introduce myself, I'm Manjith Narayanan. I'm a pediatric respiratory consultant at Leicester Royal Infirmary, and I'm lead the PCD management for pediatrics at in Leicester Birmingham Centre. As you say, the question has got a lot of sub-questions, so I'll tackle each one in turn. The first part of the question is about whether it will go on longer than the end of June. When shielding was first started by the government, it was a blanket approach, which was more of a safety first approach, I think, which was based on very little, if any, information that is available. We all knew that COVID was out there and it was serious. We didn't know what was the effect on people with respiratory or other conditions that might increase the risk of severe disease. Now, when things progress, we are sure to get more and more information, evidence, and I'm sure that advice regarding shielding will mold with the availability of the existing or information that becomes available. So again, we have to differentiate between the shielding advice for extremely vulnerable groups and the vulnerable groups. What I think will happen is that rather than a blanket approach, we will be able to get more and more nuanced information, and therefore, hopefully, more bespoke information and advice might become available. Now, the second part of the question, will we have to wait for vaccinations before we can go out again? We have to remember that it is not a short duration we are talking about here. Vaccinations, the earliest that we think is potential is early next year. So I'm certainly hoping that that won't be the advice for the best part of 7-8 months or so. Again, the advice will be dependent on the severity of the disease. So, for example, if there is other components like heart disease in association, immune problems in association, or they're on steroids, and presence of lung function. Currently, we don't have the data available yet to give any specific advice, but I'm hoping that with time we'll be able to give more specific advice to people.
Okay. Thank you very much. Okay, so we'll stay on the shielding for a little while. Woolf, I think we had some questions about children going back to school and whether their brothers and sisters can go back to school. So even based, so we probably know that no one's probably going to go back to school until September out of our community at the moment. But based on what Manjith's just been saying, you know, what will happen if we've got a severely vulnerable child that has got a low lung function and is not very well? And what about their brothers and sisters going to school? Do you think going forward? So at the moment it's a bit difficult to say, but going forward, what do you think we will do there? Would you advise families on a case-by-case basis?
Yeah, I think at this point, if we're trying to think what's going to happen in September now, it's a challenge, because the reality is things are going to change over the summer. We'll have a much better idea about the course of the illness in our patients and whether it's something we need to be worried about or not, I guess, more. We'll have more data on that. September feels quite a long way away for us to make guesses at the moment as to how that looks. I think the advice, as you say, at the moment is the government, just to go back to it, as you say, the government are saying kids can, in years 1R and year 6 can go back to school in June. The advice we're giving is that we feel patients with PCD shouldn't do that in the first wave. Just to talk to siblings, I guess, because the question we're being asked a lot at the moment is, okay, so in June, PCD patients can't go back, but can their siblings go back in June? And I think the advice that PHE, Public Health England, give on that, I think is helpful. And that's to say that, so just in this next phase, in the summer term, end of the summer term, if a sibling is in one of those years that would be going back, then you've just got to be a bit cautious about that and the risk that they might have of bringing home COVID, I guess, in that context. And so it's going to be individualised to families, but if you've got a intelligent year 6 child who is going to obey social distancing rules, and a school is brilliantly set up for social distancing, and those sort of assurances can be in place, and you know, the family feel that child really would benefit from being back at school, a non-PCD child, then there could be an argument made in that context for a sibling to go back potentially. On the flip side, I think it would be hard to say a year R sibling would be able to socially distance sensibly and safely, even if the school were set up to allow for that. So the reality, I think, for this side of the summer holidays about siblings is going to be varied on a patient by patient, family by family basis, really. And so I think for that, I think if families have got questions about having to talk that through, they should ring their PCD centre to be able to discuss that individually, really. I think it's hard to be generalised in that frame. But I think, as I say, the statement is going to point to the PHE guidance, which I think is quite clear and helpful on it. So I'd refer to that and then come back to the centres for questions around it, really. I think, as I say, if we're looking forward to September, I just don't think we can hypothesise really honestly about that at this stage. And I think we'll have a much better idea as the summer goes by, as we've tested the water a bit about what happens in these next couple of months of kids going back and more primary school kids potentially going back before the end of this term, and using that information and also data from Europe and other countries that are unlocking down and unshielding ahead of us, and what information is coming from those countries to help inform the decisions we make in August, really, to plan for September. And I think we'll just have to wait and see a little bit with that, I'm afraid. I don't think we can be more helpful at this point.
Okay. So going on from that a little bit, what if your mum or your dad or your partner back to work? So if you're a parent of a PCD or you're an adult with PCD and your partner has to go to back, how can we protect those people left at home? Anyone want to volunteer to answer that one?
Well, it's Simon here. So I think there is quite specific advice for this on the gov.uk website for people who are living with people who are shielding, who are actually going out to house. And I think, again, you know, I know we keep saying this, but I think you've really got to look at, have a sensible discussion with probably your PCD clinicians. And it's going to be an individualised decision for every family group, because I think, you know, the principles are fairly clear. How much those principles are based upon hard evidence is debatable, but we're generally adopting a cautious approach. But I think there are more than one consideration here. It's, you know, people's well-being is not just about, you know, the health aspect. There's a financial aspect, there's a social aspect, you know, all these need to be taken into consideration for the individual. But I think what all I would suggest families can do is to arm themselves with as much information as possible, and then make a family decision about it. You know, get helped by people, but unfortunately, I don't think the government or the NHS or your PCD centre is going to be able to give you chapter and verse to say, you should do this because it's the, you know, absolutely right thing to do, because I think that's going to be an individualised decision down to people's psychology, their social circumstances, their financial circumstances, and, you know, the health of their child as well. So I don't know if that's helpful, but I'm sure I think most people will have looked at that gov.uk website. If you just put shielding into Google, it'll come up in the first 5.
Okay, thank you very much. No, that's really helpful. Right, Lucy, do you want to go on to the last few questions that we have then?
Yeah, we've got one more about being a teenager.
Oh, sorry, I forgot about
we're doing good relay here, aren't we?
Yeah, sorry. Yeah, yeah. So again, we might not want to ask this question. So we've had a few teenagers who are desperate to go out and see their friends and see their boyfriends and to have visits in the garden by their friends, and the mums, are PCD mum warriors, as we're sometimes called, are really keen to protect their kids and saying that no, that this just can't happen. But obviously the government advises that you can't have visitors. Can they go, if they're allowed out exercising, are they allowed to go exercising at 2 meters distance from their boyfriend? Wolf, what do you think?
Thanks, Fiona. Again, so as you say, the government advice is that shielding is shielding, and that is isolating families, and to my mind that should be the principle here in principle. I think if people want to discuss individual cases with to consider other views on that, then they should speak to their local centre and discuss that on an individual basis. So I think my view from more globally about it is that we've just got to be careful. We don't, as Dan and we've all talked about, shielding is offering us great protection at the moment. What we are unclear about at the moment is, as shielding stops, what's going to happen to our patients and whether we're going to see a massive rise in significant illness in our patients or not. And we just don't know that quite yet. And so, as Simon and we've all been saying, we just got to take a cautious approach. And I think for the time being, shielding's in place. That would be our advice. Well, that'd be my advice anyway. Others might take a different view, but I think do discuss it. If there's individual reasons for discussing that further, in certain circumstances, I discuss that with your local centres. But that'll be the principle.
Yeah, I mean, I can absolutely understand why those questions are being asked, and I think that what's really important is this is not going to go on forever. And I think that I totally agree. I think we should follow shielding because there's going to be a risk to the other person. But I think that we will slowly come out of it and they will be able to see their partners or their boyfriends and girlfriends in a not too distant future in a sensible way. But we just need to work out how that's going to happen.
Okay, thank you.
That's really useful.
Okay, right now, Lucy, it is your turn now. Yeah.
So we're down to the last set of questions. Thank you, everyone. So this set of questions on sort of care and treatment during this pandemic. And I was wondering, Priti, could I ask you, do you think PCD patients should still have the flu vaccine this year? And obviously, a lot of people are nervous about, having to go to the doctor or going to hospital. So what are your thoughts on that?
Hi, so thanks for the question. I'm Priti Kenia. I'm one of the pediatric respiratory consultants at Birmingham Children's Hospital, and I look after PCD patients there. So that question is quite sensible, and the worry is about actually getting out of the house and visiting the GP surgeries in the first instance, but allowing for that risk, which most GP surgeries are managing in an extremely well organized fashion. I think the risk of not having the flu vaccine is much higher than the risk of avoiding that trip to the GP surgery. And therefore, we would strongly advise that we carry on the normal vaccination, as that is completely essential to the overall care and maintaining the risk from flu, etc., that we would then not be able to mitigate.
Brilliant, thank you. I've actually got a bit of a follow-up to that, which is someone said that their son hasn't had a pneumonia vaccination, so the pneumococcal vaccine, I'm assuming that is. They're 8 years old. Is this recommended?
So I'm presuming that they have possibly missed this as a part of their routine schedule, and therefore, like with all vaccination advice, which is extremely well evidenced in terms of their protective value and the essential nature of those vaccines to that individual and to the community, definitely strongly advise that they go ahead and have the vaccination. If, however, at this point in time, they are posing a risk by getting to the GP surgery because things are not in place, perhaps it may not be unreasonable to defer it for a few more weeks till we are a bit more clear about the risk going out of their home is. But certainly that should be on the plan to have it.
Thank you. Oh yeah, sorry, Woolf.
Just to add, when I saw that question, I was just wondering if sometimes there's a bit of confusion about pneumonia vaccinations, I think, and some families perhaps don't appreciate as they might. I may be doing them a disservice, but as Priti clearly says, the pneumonia, the PCV vaccine is part of your routine primary vaccination. So all children since maybe 2006 have had a pneumonia vaccination as part of that. Now, there is an additional vaccine called the pneumovax vaccine, which for children, because they've had the PCV vaccine, we don't tend to worry about too much in children. So some parents may think they've not had this extra pneumonia vaccine. Actually, almost all children, because now everyone up to the age of 14 would have had it, has had a pneumonia vaccine as part of their primary vaccinations, just to say.
Yeah, I agree.
That's really helpful. Thank you. And okay, so the next question, and I think this might be useful to have it from the peds teams and the adult teams, but Manjith, if I could start with you. There's a question here about if we take prophylaxis antibiotics during the winter, should we continue through the summer this year? And also, just a follow up to that, which is there seems to be some talk online that azithromycin might help fight COVID-19. And should this therefore be our go-to rescue antibiotic?
Yeah, there is a lot of news and excitement out there regarding azithromycin. So I'll tackle the first bit of it, which is if you take prophylaxis during winter, and the advice previously was that antibiotic should be discontinued in summer. I think many children are on that kind of a regime where they are on during winter and off during summer. We haven't seen any clear evidence either for or against continuing azithromycin. Okay. So on the other hand, there is no evidence of harm in continuing for 6 more months and continuing through this epidemic. Given that basically azithromycin is trying to prevent bacterial superinfections on top of viruses, and there are some viruses, severe viruses around, it might be sensible to continue the azithromycin. Now, or other prophylactic antibiotics. So generally, our suggestion has been that we don't make wholesale changes to the treatment or management regime because of the presence of COVID out there. Now, the second part of the question, whether azithromycin helps fighting COVID-19, that again is not yet fully evidence-based. There's a lot of research going on, and I think the way that I think about things is that it is important to use those as part of a research rather than as a part of a individual management plan. And there are both research from the preventative aspect as well as research from the treatment aspect of COVID that's going on. And I think many of them are randomized control trials. So I think I'd advise azithromycin only as a part of that until the results of the research becomes available.
Thank you. And then what about from the adult teams? I don't know whether one of you like to answer as well.
Well, I'm quite happy to answer. I think that probably the answer to the question is no, you shouldn't continue antibiotics. And the reason for that is what we're finding in both people with chronic diseases is actually incredible stability, because you're not actually seeing all the viruses and viral infections you normally see. So actually, the fact that you're actually shielded, I think, is actually probably reducing exacerbation rate. And I don't think actually having an oral antibiotic will necessarily protect you. Azithromycin is a very interesting antibiotic, and certainly there is some evidence in vitro, which is in the laboratory, that azithromycin may have an effect. We also know that azithromycin combined with other drugs can also have toxicity, so we do need to be careful of toxicity. My feeling would be is that your particular unit will know exactly what to treat you and have guidelines as to how they wish to treat you if you got a suspected infection of COVID, and I think it should be actually managed in that way. I think for everybody just gone to azithromycin prophylactically, there just isn't the evidence to do that at this present time. So I think that absolutely there's a lot of interest. There are studies, clinical studies going on, both in hospital and also actually interesting enough in primary care to see whether the addition of azithromycin or another drug called hydroxychloroquine. But there's also been some good studies that have shown toxicity. So we do need to be careful when we combine all these drugs. So at the moment, I wouldn't change what antibodies you are. You should have an emergency backup antibiotic at home. And I think that your local unit will decide how best to treat. And certainly we would use azithromycin as part of a regimen for somebody who got acute severe exacerbation.
Okay, so best to ask your local unit if you're an adult then.
So Simon, can I just chip in there? So I echo what Dan just said, that, you know, we recommend that everyone should have a backup course of antibiotics. We generally choose that on the basis of what people's sputum microbiology is, and azithromycin may not be the best one for you. And therefore, I think you should have a backup supply of whatever you're recommended to have. Going back to the research, there's a lot of trials going on, particularly in the UK, about azithromycin. So there's probably the biggest worldwide placebo-controlled trial in acute COVID is called the recovery trial, which most of the UK hospitals are having, and azithromycin is one of the arms of that. So we should get some preliminary data from the recovery trial coming out, probably sort of mid-late June, I would suspect. So we may have a little bit more knowledge about that at that point.
Brilliant. Thank you. And then one more question, and I don't know if anybody wants to take this one. So I've struggled with my mental health during the pandemic. What support is available to me?
No one say anything. I don't mind
going. Brilliant, thank you.
So, I mean, this is a big topic. I mean, obviously, it's well recognised that people with any form of chronic disease, that can affect you mentally just as much as it can affect you physically. I think certainly if you look at the general population, there's an awful lot in the news and in social media about people's mental health being generally affected. And I think that's to be expected. And I think the phrase, it's okay to not be okay, is very apt in this situation. And it's perfectly reasonable to be feeling stressed and anxious and uncertain, because the whole world is like that. And there's lots of drivers for that at the moment. I think what I'm saying to people is, and I'm saying that to people not just in a professional basis, but also in a personal and a family basis, is that try and be proactive. I would, you know, there are well-documented things that you can do to almost prevent mental health, or, you know, reduce the risk of it happening. And most of us know all about this. So, you know, it's reaching out to friends, maintaining your social contacts as best you can, regular sleep, regular diet, exercise is in part of that. And, you know, I think these are well known, and people should try and get into a routine where they sort of keep themselves as well as you can. Now, you know, I like to say I'm doing all this personally, but, you know, I'm doing the best I can. I think the other thing to say is there's an awful lot of help out there. So obviously you have your PCD centres, you have your other teams your GPs who potentially you can reach out to. If you go online, there is an awful lot of data around that. You know, even if you just go on something like as simple as the BBC website, or, you know, if you go on the Young Minds website, on that, literally, if you put mental health and coronavirus into Google, you will find an awful lot of information out there, most of which is very reputable. And again, I think, you know, I would encourage people to sort of do that as best they can. And I think if things are getting to a pressure point, the most important thing is to reach out to someone, because it's very easy to feel very isolated and very alone and the only person going through this. And obviously that's not the truth, but it doesn't mean that you can't feel like that. So I think that would probably be the main message, is make sure you look for help and be proactive.
That's brilliant. Thank you.
I'd just like to add to that, to also say that there is the PCD services are all running as usual. So of course we are all doing a little bit of a different job, but there is the support structure still in place with the MDT staff available, the consultant teams available. And I think I would request that patients do not feel hesitant, because I know that a lot of patients are feeling that they shouldn't be disturbing us in such a stressful time, but we would like them to reach out to us to make sure that we can give the support that is available to them in whatever way is possible.
I should add that we have had feedback from some families that have reached out, and they've just said how grateful they are to all of you guys for your help. So yeah, it's really, really useful for us at this time. So thank you.
And just to add to, sorry, Fiona, just to add to Priti there, I think that's a really important point, because what we are seeing is people presenting sometimes a bit later than they might do because of that concern. And they've already, say, for example, had an established chest infection that might need a bit more treatment than they might have been able to deal with some more antibiotics and increases if they'd sought advice earlier. So we'd be really keen for people to be aware that we are here for them, and they need to contact us and be chatting to us about problems they have early. Okay. Thank you.
Brilliant. I can't thank you enough for your time this afternoon. When we had the pre-meeting meeting last week, I said to one of the doctors that actually our patients were really pleased to see that you're all looking so well. And I don't think you underestimate how important you are to our families. So all of us, the children and the adults, really appreciate your you looking after them, and you are part of our extended family. So it's great to see that you're all really well, and it's also great to see that that you are, with all due respect, struggling to answer some of these questions, as we are as well, group, because we just don't know what's going to happen. But I think the key message today is that everyone has to be cautious. They have to stay in till the end of June, and then we will review again, and we'll probably have another session like this at some point so that people can ask questions. The next opportunity I think that we'll see is that on the 27th of June is our annual general meeting. And so which will be online. So again, it would be great if some of you could come and answer some of our patients' questions on that day. But we really can't say thank you enough for your help. Really do appreciate it. So as the NHS say, stay alert, stay safe, and we'll hope to see you again soon. Thank you very much.